Let's find out more about this increase in cases from the regions from OCTA Research Fellow, Professor Guido David. He joins us on the phone. Good morning, Professor David. Good to be talking to you again.
Yes, hi. Good morning, Ria.
Now, Professor, how alarming are these cases on the rise outside NCR? Should we be overly worried?
Well, we shouldn't actually be overly worried yet. Right now, Zamboanga City has been the city that has been consistently having a high number of cases. So we could be a little concerned about Zamboanga City. But as for the other cities we mentioned, like Iloilo, although there was a significant increase in cases, we've only seen it for the past few weeks. Same thing with Cagayan de Oro. In Cagayan de Oro, the number of cases has actually stabilized a little bit. So the trend is not a strong upward trend. But we're seeing a steep rise in cases, as you mentioned, in Iloilo City and also in Davao City. But in Davao City, the cases are relatively low. So we are continuing to monitor these places because if they continue to increase further, then it would definitely be alarming. But right now, they're still, you could say the case count is still relatively low, except for, as I mentioned, Zamboanga City has a high number of cases, and we're also concerned about Puerto Princesa because of its high positivity rate.
All right, definitely we need to be on the lookout for these cities. But in your view, Professor, what are the possible causes of the increase in cases in those areas?
Well, of course, lax border restrictions could be a cause for, a reason for the increase in cases. And of course, we don't know if the variants are spreading in other areas in the Philippines, and that's what we're watching out for, because these variants can be concerning because they are a lot more infectious compared to the previous versions of the virus, and that's why it's always good to have some measures in place for our border controls, and we understand the mayors in CDO saying that people are more aware now, but sometimes people are also not aware because they might not have symptoms, but they could still carry the virus.
You mentioned the variants. Do we have enough data to tell us the effects of the Indian variant that has come to the Philippines?
Well, we know that it has been detected in a few cases in travelers who landed in the Philippines, but right now we're not seeing a community transmission yet of the Indian variant based on the numbers. But we're continuing to monitor again the numbers in case we see spikes. But right now, it's too early to tell. It's possible that it might be spreading in some of these areas that we mentioned. And if the numbers continue to rise, then definitely we should be concerned. I believe the Department of Health is probably looking to have more biosurveillance and genome sequencing for these areas. But right now it's too early to say. We don't think it's spreading in NCR plus, but we can't say for sure if it's spreading in certain regions which are seeing a spike in cases.
Right. In the areas that are experiencing this spike, it seems to be at least a little early in the game. So there's time to contain it and allow it or not allow it to get worse. What do you think needs to be done to address the rise in cases?
Well, definitely still too early in the game. You're correct. And that's why we're sounding the alarm early so that we can, beef up our systems, put our systems in place. Definitely contact tracing should be expanded. Same thing for testing, especially for areas with a very high positivity rate like Puerto Princesa. But even in other areas like Iloilo, definitely we could use an increase in testing and scale up isolation facilities and maybe prepare hospitals. Those would be good things to do for the local government and, for the national government to assist in that.
Right. It is always so much of the testing and the contact tracing. But let's talk about vaccination. The aim is to achieve herd immunity in the Philippines by November or the end of the year. Do you think that's possible?
Well, if we're talking about the entire country, that's about 70 to 80 million Filipinos by the end of the year. It might not be possible due to logistic issues and due to the amount of vaccines that we're expected to receive. But what we are looking into would be a targeted vaccination program wherein we would focus on priority areas, and these would include large metropolitan areas like the NCR, Calabarzon, parts of Central Luzon, maybe Baguio City, Cebu, Metro Cebu, Davao, Bacolod, maybe even Iloilo. And then we focus on these areas because they are at the most risk for a surge, and by doing so, we can optimize our allocation. And even if we can't achieve herd immunity for the entire country, we might be able to achieve close to herd immunity for these select areas. And that would, in effect, control the surge, and it will also affect the entire country because if we don't have a surge in these metropolitan areas, essentially we're indirectly protecting the other regions as well.
That's right. Thank you always for your expertise. That was OCTA Research Fellow Guido David. Economic